May I now invite Mr. P.P. Rajan, Senior Manager Administration, Ayurvedashala Kottakkal, to address, please.
Most Honorable Dr. Raghu, DGHS, my co-panelist, Dr. Indu Chudan, luminaries in the audience, Bijon Mr. Sir, Dr. Upadhyay Sir, Sambat Sir, our own Dr. P.M. Warrior, President AHMA, Dr. Sanil Kurunjikatil, General Secretary, Dr. Idu Unikrishnan, and such other great luminaries in the audience. A very good afternoon to you all. I would not be taking more than 10 minutes, sir. Just for your kind information, so that kindly be seated patiently. We are here to chalk out, as tabled by Dr. Bijon Mishra, sir, a long-standing, solvable, and patient-friendly, people-friendly, institution-friendly, regulator-friendly policies for the days to come. Thank you, CII, for setting the most relevant and sought-for subject for the day in the current healthcare scenario, where the care cost is spiraling in the upright swing. This is timely, contextual, having lots of relevance in the dynamic healthcare sector in the country with vast potential in terms of economic value and social relevance. I may repeat, Professor Bijon Mishra, while tabling the essence of the subject, emphatically urged all of us in this august assembly, the policymakers, the regulators, insurers, intermediaries, and the healthcare providers to tighten the shoes, get marching, and get aboard, else we will lose the boat. The subject in the sensitization program has come a long way of discussions, deliberations, and policy making. The IRDS circular dated 31/1/2024 changed the velocity and momentum, and now the industry leaders have stepped in, taking the clarion call. We have heard a lot from the respected speakers. Thanks to Dr. Raghu for elaborating us on the steps initiated by the ministry with regard to the standardization, and to Dr. Indu Chudan, the painstaking taken by the AHMA in the field of getting standards in the treatment. Now, let us discuss little about the very first component of the whole dialogue process, the insured, that is the patient. In Gandhiji's own terms, the customer, the Maharaja, or the Marij, a simple patient. The patient needs to be empowered to make decisions about the health insurance. He should have necessary information about the need, the availability, the selection, and of course the cost factor of the healthcare policies of his requirement and choice. Though the primary role in this regard would be that of insurers, Sambat sir will be detailing on that, we all need to be proponents and propagators of this exercise. The insurance companies will grab the opportunity and come out in the market with more tailor-made Ayush-friendly products. The healthcare organizations, the ambassadors of the products, shall devise customer-friendly mechanisms to promote healthcare policies through empanelment. Our Upadhyay sir had mentioned that you should come out with a program, and we, the hospital, should come out with customer-friendly, patient-friendly programs. An insurance desk having adequate and precise knowledge about who, what, when, where, and why of the policies. You may add with why not also of every query addressed by the patient or by the customer need to be answered from the hospital. No need of mentioning the qualitative changes with regard to the structure, process, and outcome of the entire care plan that are the part and parcel of the agreement between the healthcare organization and the insurer. Regulators of both the parties and Ayush will definitely have a whip in the hand and will intervene as and when necessary, invited or uninvited. Now comes the finance part of the whole exercise. In the cases of cashless empanelment, the agreement with the concerned insurer would be necessary and the minimum freezing period rates would be, I think, for 2 years. You may correct me, sir. With the one insurer. The hospital will get into agreement with another insurer after 3 to 6 months or any time in the days to come. And the exercise will continue based on the demand and supply theory. At the end of 1 or 2 years, there will be different agreements for different period with the different insurers and at different rates. I repeat that, there will be different agreement with the different insurers for different period. And the role of different TPAs in this context also is an important force to be reckoned with. Now there will be different rates with different insurers for different time period for different service. This will undermine the very principle of uniform cost for uniform care established by the quality regulators. It would therefore be ideal to have the agreement for 1 year or so that the minimum variations of rates are in force at any given point of time. Another important one is about the settlement of bills. At this preface, let me request the insurers to please consider the healthcare organization as your eyes and ears. We are your partners and the one and the only one link between the Maharaja. Let's become an arbitrator for the good cause and promote both healthcare through health insurance. We are part of it and we are party to it. And please do not consider the same barometer for all the padis. The consideration to treatment to well-being in Ayush is a tapasya. We go by the darshana, sparshana, and of course prashna. In diagnosis, and modern investigation tools may be complementary and may not be compulsory. So please do not question the wisdom of a Vaidya, a noble Vaidya. If he prescribes a bandage or bandhana without an X-ray. No need to mention the efficacy of Ayurvedic treatments in non-communicable diseases, post-stroke management, and autoimmune diseases. The list goes on, and everyone is quite sure that the pathophysical conditions of the disease as well as the constitution of an individual matters in diagnosis altogether and the treatment as well. Some more facts about the above said incidences. In the case of cashless facility, the admission takes place after approval and the discharge takes place only after approval of final bill from the insurer. The patient is already left, and if the onus of further scrutiny is left with the healthcare organization, the poor owner or the doctor will be in great dilemma or distress. So let's plan at this platform, let's sit together and resolve that the payment shall be effected at the earliest, say a week or so. If the payment is delayed inordinately for flimsy reasons, it affects the healthcare organization very badly. And for me, no need to elaborate much upon that context, it's a financial matter. Of course, the black sheep should be identified, isolated, exposed, and let the law take its own course, but not at the cost of others in the sense the actual patients and actual healthcare providers. Many things have been dealt with by earlier speakers, and I am sure that further speakers would elaborate much on the subject and add value to it. Finally, the regulators and policymakers would definitely take cognizance of what is happening today and come out with amicable settlements. And as happens in UN and all, we come out with a declaration of Trivandrum, hosted by the Confederation of Indian Industry, Kerala, attended by a great advisor from the Ayush ministry, then our Upadhyaya sir and the Sambat sir from the GIC council, comes out with a valid, solid, acceptable in the sense acceptable to the regulator, acceptable to the healthcare organization, acceptable to the insurer, and acceptable to the common man, so that Ayurvedam becomes the front runner of healthcare provider in the nation. Thank you for listening to me. Thank you all.